So I've been asked to talk a little bit about the distinction, I guess, between conventional psychiatry and psychedelic medicine. So when I think about these things, I think I tend to think about them simplistically. Uh, I sometimes look at the history of psychiatry in a very simplistic, bifurcated manner. Uh, Pre and post 1950s sometimes. Uh, Pre-period often being referred to as the era of brainless psychiatry, and post sometimes being referred to as the era of mindless psychiatry. And that's referring to pre-1950s, the field was really dominated by Freudian psychodynamics, and a very theoretical model of the mind and mental illness. And then circa 1950, lithium for bipolar disorders came on the scene, and chlorpromazine was the first antipsychotic agent, although it was initially referred to as a major tranquilizer. After that, I think mid-1950s came the antidepressant therapies, benzodiazepine therapies, and eventually the even more familiar therapies like the Prozacs in the late 1980s that sort of ushered in the more modern field of psychiatry that we're all familiar with. And the more modern era is a field that's often referred to as the mindless era of psychiatry because it's so focused on the biological understanding, be it genetic, be it neurochemical, or the treatments, which are typically by and large pharmaceutical in nature. So both of these models have severe limitations. So with regards to the psychotherapeutic models, I think every experienced psychotherapist will, going right back to Sigmund Freud, will say that the bane of the psychotherapist is resistance. And if you're dealing with mild or moderately entrenched neurotic disorders, psychotherapy is actually very effective. Probably the most effective treatments that we have are psychotherapeutic. But having said that, most of our patients are probably not mild or low resistance. And so when you have high resistance patients, then you come up against a wall because the patient is essentially defending themselves against the therapeutic effort. And hence the limitations on psychotherapy. With regards to conventional agents, the antidepressants, the antipsychotics even, unfortunately, we're in a situation where, despite ever increasing prescribing to the point where a very significant minority of the Western population now is on these agents, at the same time, we have only ever increasing rates of mental illness. So depression, anxiety, substance abuse, disability, all the way to suicide. So there's a major disconnect here, which I think is related to the fact that our pharmaceutical interventions simply aren't as helpful as we would like them to be. And we're living now in an era, especially in the past few years, of ever increasing skepticism of these more conventional therapies, and an era of ever increasing mental illness. So enter the topic of psychedelic medicine. And although no panacea, they certainly are a ray of light insofar as, in a sense, they offer up the sort of holy grail of psychiatry, which is the idea of the confluence of the biological and the psychological. These agents, in general, offer symptomatic relief, but they also are facilitators of psychotherapeutic progress, breakthroughs, insights. They have neuroplastic effects which I often think of as brain fertilizer effects, which seem to entrench the psychological, psychotherapeutic, symptomatic gains which are achieved with the therapy. And on top of that, I've long thought that in an overly simplified way, one could think of all psychiatric disorders as some variation on the theme of PTSD, insofar as trauma always seems to be somehow at the heart of them. Psychedelic agents are very much trauma agents. They open up the mind and they allow trauma in a safe context to come to the surface. In that sense, they truly can be seen as the royal road to the unconscious that's long been sought after. And on top of that, with the ego dissoluting effects of the psychedelics, the mystical experiences that come along with the psychedelic experience seem to add, I sometimes think, the fourth leg to the table, whereas we're taught the mantra of biopsychosocial psychiatry in residency. But in fact, I think probably more holistically speaking, biopsychosocial spiritual is more appropriate. So this is a very exciting era for psychiatry and psychology. And from the therapeutic perspective, what's also fascinating is we come to the field with our own specific ways of helping. I'm intensive short-term dynamic psychotherapy. Other people maybe CBT. There's everything in between. And those skills are all important and useful. But when it comes to psychedelic therapy, even the most seasoned therapist ends up realizing that they move from the role of director more to the role of the midwife or the facilitator, the guide. And so psychedelic medicines and psychedelic-assisted psychotherapies truly do seem to be ushering forth a very exciting new era in the field of psychiatry, psychology.